Functional orthosis for basilar joint arthritis. Here we will demonstrate how to make a functional orthosis for patients with basilar joint arthritis. Use a strip of 6 cm wide Orthicast. Measure 2 times the width of the hand at the level of the MCP joints and cut the Orthicast accordingly. After heating, fold the material in half widthwise and stretch it a little. Cut a hole for the thumb at 1/3 of the material. Pull the Orthicast over the thumb, making sure that 2/3 of the material cover the palmar side. Pull the small part of the material towards the dorsal surface of the thumb. Connect both parts together on the dorsal part of the hand. Put the thumb in the optimum functional position. Carefully mold the palmar arches while exerting a light traction on the thumb. Apply a minor pressure at the base of the thumb's MCP joint. Remove the orthosis after it has hardened. Trim the edges on both sides of the dorsal side of the orthosis. Remove excess material around the thumb, thus permitting the opposition of the thumb and freeing the thenar eminence as much as possible. Be sure to preserve sufficient material in order to exert pressure on the base of the thumb's metacarpal. For the strapping, use 2 small strips of Velcro loop. Heat the inside of the orthosis on the opposite side of the thumb briefly with a heat gun. Attach the first strip of Velcro loop with an upward inclination towards the thumb. Attach the second strip of Velcro loop with a downward inclination towards the thumb. Heat a small piece of Orthicast and stick it over the edges of the Velcro loop to secure its bonding. Mark the direction of each strip on the thumb side. Cut a small slit for each of the strips on the dorsal thumb surface. Pass the Velcro strips through these slits. Heat the dorsal surface of the orthosis on the opposite side of the thumb briefly with a heat gun. Heat the self-adhesive glue of the Velcro hook with a heat gun and stick the Velcro hook on the orthosis with sufficient pressure. Finish the edges of the Velcro loop. Round the corners of both Velcro loop strips. Heat 2 pieces of Orthicast with a heat gun and carefully seal the edges so they do not slip back out through the slit openings. Cut away any excess material. Try the orthosis on the patient and check the fit.